Before I get started, I want to disclose that I am no expert whatsoever. This is just all my personal research and info that I got from the doctor that I will have the procedure done, or at least my appointment with, just to get more information. So go do your own research, go ask your own experts and such, but this is just what I know and my opinion to this procedure as to why I myself want to get it done. And so I'm putting this out there just in case if there's anybody that has this in mind, just wants more information, or just wants to see what my experience was like, or anything like that. It's just informative, as if I'm your friend and we're just having a conversation. I wasn't sure if I wanted to put this out there, but I don't see anything wrong with it. Obviously, it's a topic for females and to prevent pregnancy and such. Personally, I never used birth control because my body would reject anything that I used. It was not good for me. TMI, things like that. I didn't want to go on the pill. I know there's different kinds out there, but I've seen like putting all this unnatural hormones and things like that into your body really messes it up. I wanted to give something a try that I thought would be best. The one that I did want to give a try, you can kind of see a little bit right there. That's the scar from it. It's been such a long time since I tried that one. That one was after I had Nathan. I tried that. It was horrible for me. For me, it was horrible. Bleeding non-stop for over a month. And what made me upset was that I was like, I'm over this. I don't even want to keep waiting because it's been a month and my body is just not wanting it. It wants it out. And I just didn't feel good. I was miserable. I spoke to my doctor about it. Not the current one that I have, just a different one. And she really did not want to remove it. She's like, you need to leave it in there longer. You should try it, blah, blah, blah. I was like, I don't want it. So that was that. And after that, I did not try any other sort of birth control just because I was like, I am just not going to deal with this. I'm over it. We had Niall. Now Niall is 4. Between Nathan and Niall, they are 2.5 years apart. When baby girl's born, about 4 years apart, because next year he's going to be 5 and then she's going to be 1. I think they're pretty well far apart. Either way, if I would have had 3 kids, doesn't matter if it was 3 boys, 3 girls, whatever the outcome, I would have been done. I always had the idea that I didn't want to have kids in my 30s, or I didn't want to get pregnant in my 30s. So that came true, I guess, because I'm 29. In my mind and everything, I'm all set. This is my last child, and I am so lucky to be able to say that I'm also a girl mom now, and so it's just perfect. I think 3 is perfect. The age gap between all of them is nice. I just really don't want to bring in more kiddos into the family, into this world. I want to be able to have the time and energy to focus on the 3 that I have currently, and then, on the way. Dedicate time to them, be able to spoil them, be able to do activities with them, take them places and such, and not be like on a tight budget. I think 3 is already enough, and it's perfect. Not only that, but I also want time not only to my family, but also to myself. So I want to have the time to focus on me, to focus on my body, and I think we're good. We're at a good age. We're closing the chapter and having kids in our 20s. We're done having kids in our 20s. And, moving 30s onward, we're just going to focus on our 3 kids and, like I said, on ourselves, and it should be good. So I have plans. 40 days after delivering, I want to get back into the routine that I had in working out. Pregnancy takes such a toll on a woman's body that it needs time to rest and then get into your routine. But I think 3 kids already took a toll on my body where it's like, okay, enough. Like, my body is done. Personally, my pregnancies were not easy. Of course, the first one's never easy. You're experiencing all of this stuff for the first time. The second one, I knew what to expect, but, you know, still had its challenges. And then with baby girl, I feel like it was the toughest. I don't know the delivery yet. We'll see. Within a year, I'd like to, during that time, I want to focus on my body. And then within a year, I want to see where I'm at and then just go from there. Like set more goals and just really tone it and everything. Just really take care of myself. So the procedure that I'm like, I want to say 90% sure, because you just never know if I learn something new and I'm like, what the heck? Like, am I sure now? But I'm 90% sure that I want to get this done. It's permanent and it's like no hormones or anything like that going into your body. It's just like a one done deal. I believe it's called a tubal ligation. And I say I believe that's what it's called because there's different types. The one that I want is getting your tubes removed, so getting pieces of them removed. I'll explain it to the best of my ability. What I've learned is that, and also by asking my doctor, after delivery, and that also depends on what time I deliver. If it's like sometime during the day, it'll be hours after that they will do the procedure. If it's sometime during the night, it'll be like the following morning type, you know. The plan is after delivery, while, you know, you're numb, this and that, they're gonna take me into the C-section room by myself. Nobody else can go in there, which I'm kind of like, oh God, okay. They'll make a small cut right underneath your belly button, and then they're gonna make another one. They're gonna put in gas to inflate you, and it's just easier for the doctor to go in there and see everything. They're gonna make those 2 incisions. One is like to see it, and the other one is to like use the tools through it. And what they're gonna do is they're gonna go get the clamps and then cut those pieces, those 2 little pieces, and seal it. So I don't know if they're gonna like burn it or something, but they're gonna cut the 2 ends. The doctor that I spoke to said that it only takes like, the procedure itself takes about 15 minutes. They stitch you up, all this and that, and then afterwards, just the overall where they'll check you and see if you're doing okay and all that stuff, it'll take about an hour. I'm hoping recovery is not as bad and it doesn't take too long, but I mean, I'm already recovering from, you know, so I assume I'm just feeling everything as it is, you know, as it goes, the same effects. Hopefully that's the case, because I do give myself about 40 days to rest, just be home, take care of myself and newborn baby, and not really go out at all. Like the side effects that I might experience afterwards is that I might experience shoulder pain and back pain, and that's due to the gas that they put in your stomach. I have an appointment coming up in just a few days to talk to an expert. I'm not sure if this is a doctor that's going to perform the surgery or if it's just someone that's going to inform me of it. And currently, obviously I'm a little nervous not to get it done, not that I'm going to be like not having any more kids. That I'm like fine with. Just the fact that like the procedure, that's I'm just kind of like, oh crap. It sucks that I'll be by myself. I really wish that I would have been able to have someone there as support. But I will let you guys know what that experience is like. On to the appointment.
So you're here because you've decided that this is the last? Is 110% sure?
Yeah, I'm pretty sure.
If you're going to get a tubal sterilization procedure, actually we are moving to just removing the fallopian tubes.
Oh, okay.
Completely, yeah. So benefits of that is you don't have the risk of an ectopic pregnancy, right? Which is pregnancy getting stuck in the fallopian tube. And it also decreases risk of ovarian cancer because most ovarian cancers actually start in the fallopian tubes. Removing the fallopian tubes completely is a great option.
Is there any like side effects with a woman?
So, risk of just having surgery, but in terms of menses, hormones, nothing. The whole point of the fallopian tubes is just get the egg to meet the sperm, continue, the ovaries can continue doing their thing. In terms of postpartum tubal, depending on what time you deliver, it might be the same day, it might be the next day, it kind of depends.
Okay.
An incision is made near your belly button, okay, either kind of through it or just up below it, about this big. And essentially, the reason why you can kind of get away with just doing that small incision is because your uterus is still pretty high up, and the fallopian tubes kind of come in on that top part of the uterus, so you can just And obviously the effects of contraception are immediate, right? If you remove the fallopian tubes.
So how long would it take to heal?
A little bit different. The only restrictions that we put on is just lifting restrictions. So you're not going to be lifting anything greater than 20 pounds for at least 2 to 4 weeks. No driving for that first week because you're going to be pretty sore. Usually Tylenol, ibuprofen, maybe some narcotic medication. The sutures will be underneath the skin, so nothing needs to come out. Under 24 hours, you can shower and get it wet, that's fine. Let's go over risk of surgery. No matter how minor or major surgery is, I always give the same risks because it's surgery, right? So I'm going to give you worst case scenarios where we have these complications, so we'll just kind of review. Infection, right? Incisions made on your skin, so there's always that risk of infection. Excessive bleeding, okay, damage to underlying structures, particularly bowel. Reaction to anesthesia, depending on how things are going, you might be taking a nap during a case, you might be out, or you might get a spinal. Clots to your legs, your lungs, your brain. You're going to get those squeezers on your legs to kind of help massage that blood while you're immobile on the table. And I always include the risk of death because it's not something I do every day.
I decided not to mention who that was and then also toned the voice, so just for privacy. That's all the info I have. Obviously, I wasn't expecting that outcome where I thought that my procedure would just be cutting off those little 2 pieces from the tubes, but I guess now they're just removing the whole tubes. I believe the surgery would be kind of exactly the same as the video that I had shown previously as an example. There's not really a purpose for them besides getting pregnant, then I don't want them. And it sounds like the cuts, the openings that they will be doing for it won't be too big. She described it, as that big. I'll do an update on this video after I get the procedure done. Obviously, I'm not going to record anything. I'm going to be not doing any of that. It's just focusing on what's happening, how I feel, how I went through everything, and then just go from there. So fingers crossed everything goes fine, not only with my delivery, but also with my afterwards surgery. So a lot's going to be happening. So until next time, we'll see how things go.